Back. February is American Heart Month, and it's a time to give pause and think about that important part of our body that often gets overlooked. But there are some things that you can do to help keep that ticker into tip-top shape. Giving me some tongue twisters there. Now I'm joined now by Destiny Petrowicz. She is with Premier U. Destiny, welcome back to the show.
Thank you.
Of course. How appropriate that we bring in, talk about heart health. Let's go to kind of a popular topic first, okay? So when we are talking about heart health, how important is the topic of obesity when we're talking about that?
It's such an important part. So obesity is actually one of the largest and most common increased risks of heart disease.
Not surprising.
Right,
Yeah,
and we see it all the time, and obesity is one of the most common medical conditions. Right, and so that means we're going to see a lot of heart disease as well. So think of it like when your body has a lot of extra weight, it is harder for the body, for the heart to be able to get blood to the entire body.
Makes sense.
When we see that over time, the heart will start to change and remodel and look different.
Wow.
It won't work as well because of that. Can lead to high blood pressure. You know, it can cause, obesity can cause changes in how we process sugars and carbs, and it can lead to high cholesterol, which also increase heart risks, right? So obesity is just a very important piece of this puzzle.
I'd say so. Okay. Well, since it is such a critical piece, then how important is it to lose weight? And let me put this caveat in there, the right way.
Exactly.
Okay.
Yes, that was a perfect caveat. You know, we see even just a modest 5 to 10% reduction in overall weight have a huge change in the risks for cardiac disease, especially when that fat is visceral fat. So that is deep fat that's around those internal organs. Not necessarily the fat that we see if we stand and look in a mirror, but the fat that's deep in there. And so, you know, there's really cool technology available to measure this type of fat. And we have this technology at Premier U. It's called the InBody machine. And this is going to give us a tangible number. What is a patient's visceral fat? And so when we see our patients month to month, we can say, hey, look at this significant reduction in this deep fat and look at your reduced risk of heart disease because of it.
Now, this is kind of a shift in thinking as well, right? This visceral fat, everybody was very focused on external and kind of BMI, but now we're taking a look at what's happening really deep on the inside and what the impact is of that, right?
Absolutely. It's so important to do, right? Just we're not looking at a number on a scale anymore. Right? That isn't a piece of, you know, that of health that's important, but yes, it's much more than just BMI, right? It's how can we improve your overall health through things like reduction of visceral fat.
Okay, so when we're trying to think about the things that we can do throughout our life, maybe at home, to make those reductions, what can we do?
It's often feels overwhelming to somebody,
a little,
right? They say, I know I need to lose weight. I know I want to improve my heart risks, but I don't even know where to start.
Exactly.
And so, you know, being as active as you can be is a great place to start. You know, trying the best to avoid ultra-processed foods like you know, fast foods, and you know, there are times in life where those things are unavoidable, but where you can, doing your best. You know, it is more important, I think, to know that you have a great medical team behind you that can help guide those, because it is hard.
Well, speaking of which, okay, so you've tried things at home perhaps, and you just can't either, one, get that weight to drop, or you just don't know what to do next. When is it time to go ahead and see your medical provider about it?
Sure. You know, I'm going to recommend everybody has a great relationship with a primary care provider, is going yearly, doing screenings. You know, our medical system is very well trained to help people, you know, with diseases and things like known health diseases, but it struggles a little bit in that preventative aspect, right? How can we prevent people from getting to that point? And that's the goal of Premier U. And, you know, our targeted, you know, audience and, you know, and patients are the ones who are saying, I got to do something different, right? How can I prevent myself from getting to the point of having heart disease? So, you know, the time is always now to put your health and self first.
Yeah, absolutely.
And Premier is happy to do it.
All right, well, if you had to leave our viewers with a final note about American Health Month, what might that be, Destiny?
You know, I would say that a lot of people feel like things like heart disease or obesity, or they're just genetics, and there's nothing that can be done about it, right? My whole family is obese, or my whole family has heart disease, and I'm just destined to end that way too. And I would say to just feel empowered that that doesn't have to be your health story.
Sure.
Preventative care is so important. And if you don't know where to start, find the team. And if Premier U is it, we're happy to help.
All right, Destiny. Hey, thank you for coming in and talking
Thank
with
you.
us about heart health and just some easy things that we can do at home to try to offset that. Maybe it's just as easy as getting up off the couch a little bit,
Yep.
or finding a really good spot where that motivation's at.
Yep, sometimes you just need a good cheerleader.
Yeah, all right, Destiny, and thank you for that.
Thank you.